A warm welcome to all our viewers to our series Natural Medicine. Today we deal with the subject of the immune system. And of course, in the time we're in right now, it is of course of great importance to strengthen the immune system as well. How can you best do this professionally? That is the question I want to ask the Chief Physician, Dr. Petra Wiekel, from the Swiss Mountain Clinic today. Because I've already booked a week with them. In April, I'll go there for a week to strengthen my immune system. And now I'm curious what to expect. Welcome, dear Petra.
Yes, that's so nice. So I created this week also because of the current situation. And we are all of the opinion at the moment that something very bad can happen to us. Just because it happens. And the coronavirus, for example, or any other viral infection or bacterial infection, is something our body goes through 100,000 times a day, because we are constantly, just by sitting in this studio, what we inhale, what we breathe here, is a multitude of small microorganisms, if we are just talking about bacteria or dust particles. The immune system has been able to recognise it immediately without any problems for millions of years. The mucous membranes in us ward that off. That means we have mucosal immunity, which we actually immediately puts an end to any intruder.
You know, I always tell myself that we are part of nature and we're so perfectly embedded in nature. Why do we suddenly have to come up with chemical substances from the outside to make people perfect? We already are.
Exactly. In general, we really don't have to.
Unless the immune system is weak, but then the cause is different.
Exactly, yes. And that's why the focus is on strengthening the immune system. Because even if I have a bacterial load and this bacterium does not find the breeding ground it needs, in order to multiply, I will not build up a bacterial infection. So we had a boy at the clinic who was only 14 years old and who had the osteomyelitis in the summer, so a strep disease that inflames the periosteum. This is a clinical picture that we don't see that often anymore, but this boy got sick with such a severe periosteum inflammation and was then given a high dose of IV antibiotics for 14 days. And still much larger and much broader, also in the concern that other bacteria might be in this severe periosteum inflammation, so that the boy is seriously ill today. He can neither eat nor do sports. He is just tired all the time, which was caused by these 14 days of antibiotics. But what I actually only wanted to say, he did not get osteomyelitis out of the blue. Because when looking back in analysis, when the findings became visible already in the anamnesis, the boy has taken the path there as part of his development. That means the immune deficiency has become so strong that an infection now actually means the helplessness of this body, and not an infection from somewhere outside that would make this boy sick. Illness is actually always the way to get well again, to break down the streptococci due to the inflammation, which is then caused by a chronic or, in this case, acute inflammation, and to make people aware that it is exclusively in their hands, that one also has to keep an eye on such immunity every day. That we are people today who also, as part of a defence, are only so strong against viruses, because viruses already belong to us. There is no one at all who lives without viruses. They are taken in with the breast milk. They are taken in with an inhalation.
Your hands are full too.
Yes, and yet we are not microorganisms. When I ask patients, do you even know what viruses are? They say, yes, they are such small microorganisms and imagine bacteria. But if you pumped up a virus like that to the size of a tennis ball, then a person would be 800 kilometres tall in relation to it. So forget about it. This is just a small DNA thread with a protein shell that is only and only ever viable unable to reproduce intracellularly, so in the cell.
Most of the people who have also come into contact with corona actually didn't get sick. But those who got sick, you have to ask yourself again, why are they getting sick?
Exactly. That's what I wanted to say. And if my body is in a good situation now, it will switch immediately to defence in the possibility of viral replication. So it happens very quickly that the body also has this guarantee. But it is a fact, for example, that my mucosal immunity is very weak. And if we measure this mucosal immunity via a stool sample, I have to say that out of 50 stool samples, I see in at least 35 that humans have weak mucosal immunity. This weak mucosal immunity has always contributed to always having an infection, having mild sinusitis, or having a runny nose. Maybe there aren't any big problems at all, but the mucosal immunity is clinically demonstrable. This can be related to the fact that people have a chronic zinc deficiency.
Are we back to a cause?
Yes, but you have to understand that first. And the clientele for whom corona is a serious disease is a clientele that had an abundance of non-intact immune defence mechanisms. On the one hand, due to the age of the people, on the other hand, and this has been scientifically proven, due to the severe vitamin D deficiency.
I was just about to say that.
Then, of course, hundreds of thousands of immune reactions are not available to you. And I am still deeply shocked somehow today that we are not even addressing this publicly.
Is it really true that a D3 deficiency means the immune system is not working properly?
Vitamin D is one of the most vital hormones. And the vitamin D has a say in whether the cell remains healthy or not. And all intracellular processes must also be controlled immunologically. We also have innate and acquired immunity. And this vitamin D that glides through the entire body and checks and watches like a police force and now sends out the natural killer cells that now have to recognise the tumour cells. It sends out the defence, the leukocytes, and above all, the lymphocytes, in order to either retrieve the antibodies against this virus or to start the first defence and form an antibody in the future. And these are all things that in this situation are incredibly valuable.
We actually have to get a mandatory dosage from the government now in this phase.
That would be unbelievable, or we would have to be compulsorily ordered by every family doctor, please come now, I want to check your vitamin D status. Because that is now immensely important.
Have you heard of the ELG miracle, an old people's home?
Yes, I heard that.
Dr. Schmiedel told me about it. The discussion is off the table, but the director of the home gave D3 to all the old people.
And that's what I really don't understand as a doctor. That all these things are important to us now. And what do we give to people? We give them rest. We might also explain to them that such a PCR test says nothing at all. It says nothing at all about any infection. It just says we saw a fraction of a virus, but we also have billions of viruses inside us. That doesn't mean we get sick now, and we are not sick, so that an infection is deduced from it. It's clinically, technically, and incredibly outrageous for me to tell people you are infected, you need to be quarantined. But actually, the doctor should now take responsible care. In this situation, we all have to be many times stronger. If people don't demand that by themselves, then there aren't enough doctors today who are really mindful of this now. Even the public documentation for me, here is a doctor in Switzerland from the canton, a letter that also formulated as point 3, how can people protect themselves against corona from doctor to doctor. Public recommendation by distance, mask, vaccination. So nothing is understood.
Nothing about D3. Diet, exercise, fresh air, nothing.
Nothing. And of course, these are things that I observe that make me incredibly stunned. How we actually fuel this fear and panic by not helping people right now. And these are things, let's come back to this week at the clinic, that are important to me to look at, such as the mucous membrane immunity. There is a so-called lymphocyte typing test. It shows me all the fractions of the immune system. This means that I can make a statement through a very simple test, which is even paid by the medical insurance, how strong my immunity is and where I have to help it now. What deficiency a fraction shows that I would need right now in virus defence. So there is this so-called Th1 and Th2 switch. So these are immune cells, these are T cells, that are needed to ward off bacteria and viruses. The other is needed to control allergies. So these are all things that I think are very important now.
These are the so-called killer cells, right?
Yes, so that I can help people in that moment. How can they stabilise these things? So there are wonderful homeopathic remedies that may not be direct homeopathic remedies, this microimmunotherapy researched by the Belgians over the last 15 years. But they contain the fragments of the immune system, and like in a training state, they stimulate the immune system to such an extent that it rebuilds its defences here. And there is enough that we know today what a healthy immune system needs as part of a high-quality supply like vitamin C or antioxidants. These are things that I might have to convey to my patients about how important it is to make a healthy smoothie, how important it is to use a sauna, how important a fever would be now if it arises.
Or to eat good fresh vegetables.
Eating fresh vegetables with a high-quality grade. The bottom line, I think, is that my body has the most sophisticated program when it comes to immunity. It showed me it would keep myself free from a tumour for 50 years. When the tumour develops, I have to ask myself what happened there. It has the best program. It was only able to form antibodies when dealing with viruses on a daily basis. That's why I simply passed so many illnesses, because I allowed it, because a healthy examination allowed me to develop defences and strength. And if you look at the age of the patients with a fatal course of disease, then there is a clientele that was very old, and we can just accept that. But the sporadic cases when also younger people fell sick with corona disease, of course we have to question very strongly. What happened there? What was out of balance beforehand? And has to be stabilised exactly there. Someone also told me that after corona he was given antibiotics and didn't feel well anymore. But antibiotics are directed against bacteria. And that is a viral disease. It is already an artificial mistake to treat a viral disease with antibacterial drugs. And what's happening at the moment is really unbelievable. And of course, to justify the path that we are all now going to.
For boosting the immune system in this week, you said D3 is a big topic.
Yes, of course. I also combine that with colon hydrotherapy.
So, cleaning up.
Well, 80% of our immunity is in the mucous membranes. We mustn't forget that now. And it's not just about cleaning up. It's really about relief, allowing regeneration. In order to perhaps measure that for someone too. Because a lot of people react via the nasal mucous membranes, via the mucous membranes of the throat, via the tonsils, when the initial burden is in the intestine. And that's only reflective, that's only secondary. It is triggered again and again here, the inflammation that may then present itself up here, and then of course in the clinic. We also support this with ozone therapy. Ozone has a very high antibacterial, antiviral, antiparasitic effect. Also incredibly improves human microcirculation, thus also the oxygen saturation at the cellular level. And it also increases the intracellular oxygen pressure, which of course when it falls reactivates viruses again. They don't always have to come from outside. They can already have been there for a long time, and of course we also have a sauna in the clinic. We have various options for continuing to work actively here. But the biggest concern for me is actually that people understand what they are not doing. You are responsible for what you do, but also for everything you don't do now. And I just want to be understood on the one hand, but also give the rest on the other hand. I also live in a limitless relaxation because I just trust myself, what my body can do. And that is dealing with many more and even greater dangers in life every day. And I have to strengthen it there, whether it's corona or herpes virus or Epstein-Barr virus. Epstein-Barr viruses are also herpes viruses. I don't know anyone who doesn't have herpes in them. But I would never dare to just say someone is infected with herpes. For this I need the clinic. For this I need the disease. And I can have a herpes virus reactivation and don't notice anything. But I can also have chronic severe exhaustion. I can get burnout and have a chronic Epstein-Barr virus disease. But I can also develop lymph gland cancer due to a herpes EBV reactivation. And now I wonder why isn't that even more relevant when I can develop a tumour due to a herpes reactivation due to my immune deficiency? And nobody's worried about it. Nobody looks at it preventatively. And I think that is a disease to be taken just as seriously as this viral, we say epidemic. For me, it's not an epidemic when I look at the numbers, but we make people sick because we do a PCR test, which does not show any infected people, but actually only presents a fraction of a gene to me, from which I still cannot build a disease. Unfortunately, that does not work.
Yeah, the topic of strengthening the immune system should really get a lot more room for discussion. And I don't understand either why that doesn't happen. The milieu is everything, and also breathing. I never actually hear anything about how a person should breathe properly.
Yes, and that's a really good point, because people breathe quickly, they are stressed, they breathe very shallowly. And yet, only after deep and concentrated breathing, the capillary opening is large. The oxygen supply at the cellular level is there. And at that moment, the body begins a completely different regulatory function. So this breathing itself is so simple, it's so easy. And yet it is something when we examine a patient, due to their vegetative balance in the autonomic nervous system, and you see that a person has been in stress mode for a long time, yet you let them breathe consciously for a minute, and then you see them getting out of the stress mode, and the parasympathetic nervous system arises. And that's unbelievable when you can show people what they have in their hands. Therefore, try to balance yourself again and again in that direction, because just toggling the switch does not mean that your entire system adapts to you. It may have to get trained first after a while. And this is how you would train it. That everything that comes with the program of relaxation, parasympathetic nervous system, regeneration, healing, your immune system, it rises up to the height of Mount Everest when you are at peace. But if you say stressed, then you are sending the signal that the immune system has to keep quiet. It has to serve the stress. And this, of course, also creates this connection. Sure.
I calculated that we breathe between 6,000 and 9,000 litres of oxygen within 24 hours. And the way we burn this, we have no regard for it at all.
Exactly. That's why I think the use of oxygen, and we work with oxygen directly into the vein with oxyven therapy. We work with HOT, that is hematogenous oxidation therapy. This means this is where the oxygen is brought into the blood outside the body and is then irradiated with UV light at a wavelength of 520 nanometers. And then the whole thing is caught again. The blood is really bright red, rich in oxygen, and is then returned. And how this oxygen therapy alone increases the activation and regulation resonance, how blockages within the blood dissolve, how the red blood cell activity suddenly comes up to speed is incredible. Just with this HOT, which I also use with all immunodeficiency patients, which I use for all patients with depression, with migraines, with headaches, with diabetes. For example, I've never seen people that had to have their eyes lasered again. Those with diabetes that used to have macular and retinal detachment, that doesn't happen anymore because you improve the microcirculation. Because these blood flow and circulatory disorders at the cellular level no longer take this great damage due to an increase in oxidation, free radicals. The eye lives at its limit every day. It needs such a high level of antioxidant protection, but the eye depends on the insanely good supply of humans also by the capillary flow area. And these are things that I find incredibly important, that we at least confront people with these things. What they can do.
In this week of strengthening the immune system, will people also be sensitised to learn by themselves in order to then implement it themselves, to show their family in the long run?
Yes, and you learn it, and you also know what imbalance has arisen in you, which you may not have noticed at first sight, but on the other hand has allowed something in your body to get a chronic viral infection. It's always just a question of immune competence. Why can't my body cope with it? Of course, never got a fever. There are some patients during that week that may go through a whole body hypothermia because we are discussing it, because we are registering. They don't even know fever.
That would also strengthen the immune system.
But of course, absolutely. And of course also sauna and all those things. And then of course that we offer people gluten-free food. Fresh juices. It will include all this in there. But it doesn't have to be the huge miracle. It just has to be the basis of what our body needs. And then it is capable of a defence that is amazing. So whatever we may call it is really no danger, because we have such a well-engineered immune system that has made us in evolution into the people we are today.
I think it's also a lot cheaper to keep the healthy people healthy than waiting for people to be sick and getting them healthy.
It would just be about time.
But it's just, I wonder, who is interested in this kind of politics? We can't always point the finger at the pharmaceutical industry. We're glad we have it, and it does a great job. But it's not their responsibility to keep us healthy as a precaution. Their job is to make sick people healthy.
Exactly.
Dear Petra, I'm glad I talked to you about the immune system. I just think it's the most important thing of all. That we pay attention to the milieu, to what defines us. We are perfect the way we are. And I don't think that just an IV, a syringe and so on, suddenly makes a person's perfect system even more perfect. I think the good Lord thought about it when he sent us into the world without vaccination. We have enough vaccinations through the birth canal, through the breast, through the environment and so on. Well, thank you, dear Petra.
My pleasure.
And you too, dear viewers. If you have any further questions about strengthening the immune system, then you can always contact us or Dr. Petra Vikler. In this regard, you can find contact details on our homepage at qs24.tv. Should you have any other concern today, then you can also use the search button on the homepage at the top right. Enter what interests you and see if there's any video coming up that deals with this topic. A great database has been created with not only the videos that are on YouTube, but also the episodes that have just disappeared there. It's all put together for you. So that's it for today. I wish you all the best and see you next time.